What do we do when we have reached the maximum dose of 4 or 5 different medications and your blood pressure is still stubbornly high? In cardiology, we call this refractory hypertension. It's a frustrating place for a patient to be, or even for doctors. But the reality is that blood pressure isn't just controlled by the chemistry of pills, it is also controlled by the electricity of your nervous system. So when the chemicals are not enough, we look at a procedure called renal denervation. We've known for nearly a century that the nervous system plays a massive role in hypertension. In the 1940s, surgeons used to perform a radical operation called sympathectomy, literally cutting nerves to lower blood pressure. It worked, but it was a major invasive surgery. Today, we've refined that concept into a minimally invasive procedure. And after a decade of rigorous clinical trials, including SPYRAL and RADIANCE studies, we now have a way to achieve the same result through a tiny catheter without the need for major surgery. The science is based on the sympathetic nervous system. Your brain and your kidney are constantly talking to each other through nerves that wraps around your kidney's arteries. In many patients with refractory hypertension, this system is overactive. It's sending a constant signal to the kidneys to hold on to salt and tighten up blood vessels. During renal denervation, we thread a tiny catheter into the renal arteries, usually through a small puncture in the groin. We then apply radiofrequency energy or ultrasound to the artery's wall. This heat energy specifically targets and silences those overactive nerves. By calming that signal, we allow the blood vessels to relax and the kidneys to function without constant overstimulation. And I want to be clear about the expectations. RDN is not a cure that allows you to just throw away all your pills. Instead, it's a tool we use to bring your pressure down into a manageable range. This procedure usually takes about an hour, and most patients go home the next day. The results are not always instant. It could take weeks or months for the full effect to be seen as the nervous system resets. But for the right patient, the one who is struggling with side effects or whose numbers simply won't budge, it could be the difference between staying in the danger zone or reaching your target of less than 120/80. In my practice, I don't just look at one biological pathway. I look at the chemistry, the hormones, and the electric signals, and RDN give us a way to intervene when the traditional pathway has reached its limit. Our goal is simple: to protect your brain, your heart, and your kidneys from long-term damages of high blood pressure. I'm Dr. Peter. Let's find the right harmony for your heart together. If you are taking multiple medications and your blood pressure is still high, it may be time to discuss the electrical side of the problem. Have you heard of renal denervation? Let's talk about it in the comments.